All right, let's talk about the Bougie. This is an amazing, awesome airway tool. Some advantages to the Bougie is the small diameter of the tool and additionally the coude tip. While using the Bougie, you have the advantage of feeling the tracheal rings as well as getting hold up with the Bougie to help with the intubation process. The first grip we're going to talk about with our Bougie is the non-preloaded pencil grip. Simply holding the Bougie like a pencil. The advantage of this is that during intubation, you get the tactile feel of potentially feeling the tracheal rings, and additionally, you get the advantage of getting hold up, helping you with the intubation process. The second option for our non-preloaded grips with the Bougie is the Shaka grip. The advantage of this is you get a little bit more surface area during intubation. Additionally, if the patient's airway is a little bit anterior, you have the advantage of pinching the Bougie, helping you with the intubation process. With this, you still get the advantage of that tactile feel.
The first option of our preloaded Bougie grips is the pencil grip. The Bougie simply replaces the stylet in the ET tube. The advantage of this is speed. The Bougie's already in place. The disadvantage is that you don't get that tactile feel on the tracheal rings, and additionally, the tube has a chance to slide over the Bougie and not be inserted into the airway.
All right, let's talk about intubating a patient with this awesome tool, the Bougie. The first step is we're going to place the patient into a flex-tension position. You can see that the ear hole is in line with the sternal notch. The next step is marching down the airway with your laryngoscope blade. Using a scissor to open up and find your landmarks. Now that I have a visualization of the chords, I can use the Bougie with the coude tip first and pass that through the chords. At this point, I'm going to attempt to feel the tracheal rings as I pass the chords, and I'm going to advance the Bougie until I get hold up, till I get resistance at the carina with the Bougie. The next step, leaving the blade in place, is that I'm going to secure the Bougie with my pinky, giving me a stable platform to pass the tube. In this position, I can pass the tube either by myself or I can have my partner assist passing the tube over the Bougie. While passing the tube, if the tube gets hung up at that arytenoid cartilage, I can attempt to twist the tube to the left to help pass the vocal cords. Once the tube is past the cords, I can then remove my blade because the blade helps keep those posterior structures off of the tube, and while maintaining a tight grip on the tube, remove the Bougie, completing the procedure.